If you have COBRA retiree health insurance coverage, this video is for you. COBRA is a federal law that will let an individual keep their working employer group coverage for a limited time after their employment ends or they lose coverage as a dependent of that employee. COBRA coverage typically applies only to large companies with 20 or more employees, but some states will require small companies to provide continued coverage for a very limited time. COBRA was never intended to be a long-term solution or a continuation by the employer. So think of COBRA as a Band-Aid health insurance to get someone back on their feet until they find other health insurance. See, COBRA coverage is typically only offered for 18 months, and in some cases, 36 months from the date the group health coverage ends. When someone turns 65, they must enroll in Medicare Part A and B during their 7-month initial enrollment period IEP since they're no longer working. So COBRA is not considered working employer group coverage since that individual is no longer working for that company. See, COBRA coverage allows the employee to continue the health insurance coverage by paying the full cost of the insurance, including what the employer was contributing to that health insurance plan. It's not uncommon to see someone paying over $1,000 a month for their COBRA health insurance plan because they are now paying the portion that they were responsible for as well as the portion that the employer was responsible for. See, if the COBRA coverage included a spouse or dependents when someone turns 65, they may extend the coverage only to the dependents for 36 months since the individual qualified for Medicare. This is another protection that COBRA gives an individual when they're turning 65 and they are Medicare eligible, which is really, really nice. So for those individuals that decide to keep their COBRA coverage after turning 65, due to the plan's comprehensive prescription drug benefit, must still enroll in Medicare Part A and B since this is considered retiree health coverage. So COBRA coverage is considered retiree health coverage. COBRA coverage will not entitle an individual to a special enrollment period SEP in the future since this will not be considered credible coverage. The majority of those that do turn 65 will inherently cancel their COBRA retiree health coverage and enroll into Medicare Part A and B due to the high costs that are associated with this type of health insurance coverage. So in conclusion, when it comes to COBRA coverage, an individual turning 65 that's being offered COBRA retiree coverage must take their Medicare Part A and B and pay the standard monthly Part B premium of $148.50 in 2021 in order to avoid any penalties in the future. Remember, this individual will need to be enrolled into Medicare Part A and B during the 7-month initial enrollment period IEP because they will not qualify for a special enrollment period. A lot of individuals that have not gone ahead and enrolled into Medicare during their initial enrollment period have ended up having to enroll during a general enrollment period and unfortunately are faced with a big penalty. This individual should speak to an insurance agent to discuss whether a zero premium Medicare Advantage plan or investing around $100 into a Medigap supplement plan would best fit their needs. If this is a situation for you, please give us a call here at Healthcare Solutions Direct so that we can kind of point you in the right direction and find out exactly what options are best for your particular needs.